friends, this is Soham Bera, consultant optometrist from India. Today I am going to tell you about a corneal problem, and that is corneal abrasion. So let's start it. A corneal abrasion or scratched cornea or scratched eye is one of the most common eye injuries. A scratched cornea often causing significant discomfort, red eyes and hypersensitivity to light. Corneal abrasion results from a disruption or loss of cell in the top layer of cornea called the corneal epithelium. Actually, cornea consists of 5 layers. Uppermost layer is corneal epithelium, Bowman's membrane, stroma, Descemet's membrane, and last layer is endothelium. So actually the corneal abrasion happens in the uppermost layer, and that is corneal epithelium. The cornea is the clear front surface of the eye, and part of its job is to focus light, enabling you to see. A healthy cornea is essential for good vision. In addition to disruption of vision, a scratched cornea makes your eye more susceptible to infection. So it is important that you see your eye specialist or visit an emergency room or urgent care center as soon as possible if you suspect you have a corneal abrasion. Now, what is the cause of corneal abrasion? There are countless ways to get a corneal abrasion. No matter how big or small, anything that makes contact with the surface of your eyes can cause you injury. Tree branches, paper, makeup, brushes, a pet, a fingernail, a workplace, debris, sports equipment, and more all poses a danger to front surface of your eye. Many corneal abrasions are caused by a noticeable traumatic event, such as getting poked in the eye. Sand, dust, and other small particles can also cause a corneal abrasion as well, especially if you rub your eyes. Dry eye can increase your risk of a corneal abrasion, particularly when apnea from sleep. If your eyes dry out while you are sleeping, your eyelids may stick to the cornea. When you wake up and open your eyes, your lids can tear and dislodge a portion of outer layer of the cornea epithelium, causing a painful abrasion. Contact lenses usually wouldn't protect your eyes from corneal abrasion. In fact, if your contacts are damaged or you wear them too long, they may have increased your risk of scratched cornea. Now, symptoms of a scratched cornea. The cornea is one of the most sensitive part of our body. So even a small corneal abrasion can be extremely painful and feel much larger in size, as if you have a big rough object in your eye. In addition to pain and gritty or foreign body sensation, other signs and symptoms of corneal abrasion include redness, tearing, light sensitivity, headache, blurry or decreased vision, eye twitching, a dull ache, and occasionally nausea. If you think you may have suffered a corneal abrasion and are experiencing any of these symptoms, seek medical attention as soon as possible or as quick as possible. Now, what to expect after corneal abrasion? People have a tendency to rub their eyes when they feel like something in them, but this can make matter much worse. If you get something in your eyes, you can attempt to flush it out with water, but don't rub your eyes. Don't patch it either, since this can speed bacterial growth and increase the risk of an eye infection. If possible, rinse your eye with a sterile saline eye wash or a multi-purpose contact lens solution rather than tap or bottled water. Microorganisms such as acanthamoeba have been found in tap water and even bottled water. And these pathogens can cause a serious vision-threatening infection if introduced to an eye or scratched cornea. After flushing the eye, if redness, pain or foreign body sensation continues, seek immediate medical attention, because corneal abrasion can cause serious harm in as little as 24 hours. Diagnosis of corneal abrasion: your eye specialist may apply an eye drop to numb your eyes so you can keep it open for the time of examination. Another top type of eye drops may be used to help your eye specialists to see the extent of the abrasion when viewing your eye with a blue light with an examining microscope called slit lamp. Depending on what may have caused the scratch and what your eye specialist sees during the exam, you might be gently swabbed for a culture to ensure proper treatment in the event of infection. Now, the more important part: treatment for a scratched eye or scratched cornea. Treatment for corneal abrasion depends on the severity of the wounds and the cause. Minor abrasions sometimes can be treated with non-preserved lubricating drops to keep your eye moist and comfortable when your eye's natural healing process takes place. As a precaution, even superficial abrasions sometimes are also treated with antibiotic eye drops to prevent infection during healing. Superficial corneal abrasion and tend to heal quickly, usually within 2 or 3 days. But other corneal abrasion may require an antibiotic ointment that stays on the eye longer, a steroid to decrease inflammation, and scarring, and something to relieve pain and light sensitivity. Large, deep corneal abrasion take longer to heal and can cause a permanent scar that might affect vision. In some cases, scratched cornea are treated with what known as bandage contact lens. When used with prescription eye drops, this special lens provides pain relief and sometimes can speed healing. Typically, regular contact lens should not be worn over a corneal abrasion because of increased risk of infection developing under the lens. Your eye specialist will tell you when it is safe to resume wearing your contact lenses following a scratched cornea. Depending on the treatment and severity of the injury, your eye specialist may schedule a follow-up examination as soon as 24 hours after initial treatment. When treated right away, most corneal abrasion result in full recovery with no permanent vision loss. But some deeper abrasion that occurs in the center of the cornea directly in front of the pupil from where the light passes can leave a scar and result of a loss of vision acuity or mild vision loss. If left untreated, some deep corneal abrasion can lead to corneal ulcer that can cause severe vision loss. Abrasion caused by organic matter in particularly can increase the risk of corneal ulceration. Attending your follow-up appointments is very important because corneal abrasion don't always heal properly and can lead to recurrent corneal erosion and other complications that can affect your vision and comfort. Now, how to prevent a scratched eye? Although many causes of corneal abrasions are difficult to prevent, others can be avoided by taking some simple or common sense precautions. For example, always wear safety glasses or protective goggles in work environment with airborne debris, particularly in welding environment. Likewise, protective eyewear should be used when doing yard work, using power tools and playing sports. If you wear contact lens, always follow your eye specialist instruction regarding how long to wear them, when to discard them, and the proper contact lens care solution to use to help keep your corneas healthy and strong. If you experience a corneal abrasion that appears to be related to dry eye, see your eye specialist for a detailed evaluation of the front surface of the eye, and if necessary, follow the dry eye treatment protocol as your eye specialist recommended. So friends, this is all about corneal abrasion. So if you feel anything, any object, any foreign matters in your eye, please don't rub your eyes. You can splash water, sterile water 2 to 3 times to remove this foreign body. After that, if it is not going, so don't rub your eyes, please go and check it. So friends, please stay safe, stay healthy, and if you people like my video, please like us, share us, and subscribe us. So bye and namaste.